And to date, we've delivered over 1,112,101 doses of all 3 COVID-19 vaccines across British Columbia. And if you are older than 55, I strongly encourage you to get vaccinated as soon as possible.
British Columbia is in its 3rd wave of COVID-19. Variants of concern are assumed to be dominant in the province now, and BC is trying to catch up by ramping up its vaccination schedule. But is the age-based criteria for vaccination still the best way to make use of Canada's vaccine supply?
So unfortunately, we have lost the race right now with vaccination and variants. We don't have all our high-contact, high-risk workers vaccinated yet.
SFU researcher Carolyn Cullen says the province should consider pivoting away from the age-based wait list.
So you can actually end up preventing more hospitalizations by vaccinating someone who is at high risk of exposure, because you may prevent many onward cases with one vaccine. Whereas if you vaccinate directly the people who are most at risk, now that the very most at risk have been protected, long-term care and those over 80, you actually protect one person per dose.
According to Health Canada, 36.5 million doses from Pfizer-BioNTech, Moderna, and the AstraZeneca vaccine from the Serum Institute of India will arrive by June 30th. But all of this is dependent on avoiding production delays. For example, while India is a global vaccine supplier, it's dealing with a large surge of COVID-19 and is using a lot of its own doses domestically.
I think with vaccines being scarce, we need to make the most effective use of every possible dose. And in order to make that most effective use of every possible dose, we have to weigh up the benefits of preventing a lot of infections and a lot of exposures to COVID with the benefits of protecting someone who may get exposed, and if they do, they're at higher risk, but who is likely not to get exposed at all.
Professor Cullen doesn't compare exposure risk between different professions. Instead, she looks at who cannot avoid high exposure in all age groups. Although the age-based criteria for vaccination continues, the approach to Whistler may be a sign things are changing, it being the latest COVID hotspot to allow immunization of all adults living and working there.
I think the pivoting idea, I think we should be really appreciative when our government is able to respond to a new situation and to new data and new information by making updated decisions and being proactive and showing leadership.
In Vancouver, Keir Junos, City News.